This module covers 2 ways babies communicate, through cues and through crying. You'll learn how to recognize different types of cues, engagement, disengagement, and the groups of cues that babies use for hunger and fullness. You'll also learn how babies communicate distress through crying, and you'll learn about persistent crying. Babies use 2 types of cues to tell caregivers what type of interaction they need. Engagement cues tell caregivers when babies want to play and interact. Disengagement cues tell caregivers when they need something to be different. Sometimes babies, especially young babies, give both types of cues at once. Other times they shift from engagement to disengagement quickly. So parents can watch for the cues, but they also need to consider the environment and look for a pattern in the baby's behavior. Let's go through each type of cue in more detail. Engagement cues tell caregivers, "I want to be near you," or "I want to learn and play." These cues can be obvious or subtle. Obvious cues include looking intently at faces, rooting, feeding sounds, smiling, and smooth body movements. Subtle cues can include open eyes, a relaxed face, feeding posture, raising their head, and following voices and faces. This older baby's cues are very obvious. By smiling, moving, and looking at the people around him, this baby is showing engagement cues. He wants to learn and play with everyone in the room.
Yeah. Oh, okay. You gonna play with your doggy? You gonna play with the doggy? Hi, sweetie. Yeah, that's Mama's stuff. Yeah, that's Mama's. Yeah, that's Mama's.
Disengagement cues are how infants tell caregivers, "I need something to be different." Obvious disengagement cues are turning away, pushing or arching away, crying, choking, coughing, extending fingers, holding their hands stiff, or falling asleep. Subtle cues include looking away, faster breathing, yawning, putting their hand to their ear, grimacing, or glazed looks. It is important to remember that although babies can communicate that they need something to be different, they can't be specific about what they need to change. For example, imagine a mom trying to nurse her baby while the family dog is barking nearby. If the baby turns away, a disengagement cue, the mother may think the baby is rejecting the breast, when really the baby is just overstimulated by the dog making noise. Therefore, parents sometimes need to be detectives to determine what the baby really needs to be different. At first, this baby seems happy watching her sister, but soon she starts to frown and gets more tension in her body. She's interested in her sister, but she's no longer relaxed and smiling. Sometimes babies need a moment away from interactions when they're distracted or tired. This baby's sister continues to play with her, using peekaboo to keep her attention. But all this attention is overwhelming for the baby, and her sister doesn't understand her cues. Sometimes babies have to communicate things that are so important that they use multiple cues together to make sure they are understood. These are called clustered cues. Because babies must be fed to grow and stay healthy, they use clustered cues when they get hungry. They also use them when they are full, so they aren't overfed, and when they are sleepy, so they get their rest. When babies are hungry, they will do everything they can to communicate it. Hunger cues include clenched fists, fists over their chest and tummy, bringing hands to their face, flexed arms and legs, mouthing, rooting, fast breathing, and sucking noises or motions. Some caregivers may think that crying and waking are hunger cues, but these behaviors on their own, without any other cues, aren't signs of hunger. Parents may need help learning to recognize early hunger cues, so they feed their babies before the babies get so uncomfortable that they cry. As with hunger cues, babies will use multiple cues simultaneously when they are full. These cues include slowly or decreasing sucking, extending the arms and legs, extending and relaxing the fingers, pushing away, arching away, or falling asleep. You can see that this baby is already sucking very slowly. He lets go of the bottle and uses his hand to push the bottle away. Because his mother puts the bottle back in his mouth, he continues to suck very slowly for a few moments, just as the video ends, because he is so sleepy and his reflexes are triggered by the bottle touching his lips. Some parents are confused by their baby's reflexes into thinking they are still hungry, but it is likely that this baby will push the bottle away again. You can help parents learn to respond to their baby's cues. When caregivers recognize engagement, or I want to be near you cues, they should interact and play with their baby. This is the best time for the baby to learn, play, and feed. However, engagement is hard work, especially for young infants, so they may not be able to play and interact for very long before they get tired or overstimulated. When parents notice disengagement, or I need something to be different cues, they need to identify the problem and fix it, or provide comfort. This may be as simple as changing a diaper if that is what the baby needs to be different. If the baby seems overwhelmed, parents should take a break from interactions with the baby and ask siblings or other family members to do the same. Caregivers may need to be detectives and try several things to determine exactly what it is that the baby needs to be different. Crying is an important survival skill for babies. When babies cry, we instinctively want to help them. It's an uncomfortable sound for you to hear because it is supposed to make you attend to the baby's needs to make the sound stop. All infants cry, and it's normal and healthy for them to do so when they need help. The good news for parents is that responding early to cues will reduce crying. However, newborns may have trouble getting clear cues. Very young babies may lack the coordination and muscle strength to give clear and consistent cues. When their cues don't work, babies may become so upset that they start to cry. Over time, parents can learn to read even subtle or conflicting cues, though, and they can learn to respond to those cues early. When babies' needs are met, they will use the same cues that worked. By seeing their babies use the same cues again and again, parents can learn to recognize what their babies need. In this way, parents and babies create their own special language with each other. You can reassure parents that their babies' cues will get easier to understand, and their babies will cry less often as they learn to recognize and respond to their babies' cues. Babies cry whenever they are uncomfortable or unhappy. If babies cry for many reasons, not just hunger, how can caregivers tell when a baby is crying due to hunger and when the crying is for some other reason? Hungry babies might cry, but they will also display hunger cues. They will bring their hands to their faces, clench their hands, flex their arms and legs, root, and make sucking motions and noises. Seeing these behaviors together lets us know that a baby is hungry. If a baby is crying and not showing any hunger cues, the baby is telling you that he is upset for another reason. This is a common misperception that you are likely to face with families. It's easy to think that every time babies cry, they are hungry. After all, if you feed a crying baby, he or she will stop crying. Babies can't cry while they are swallowing, so the baby will stop crying during feeding, even if hunger wasn't the real reason for crying. Teaching parents to look for hunger cues will help them avoid overfeeding when the baby is crying for reasons other than hunger. It is also important for caregivers to learn to recognize and respond to hunger cues before the baby starts to cry. What should a caregiver do with a baby who cries when he is clearly not hungry and nothing else is obviously wrong? Parents can try any of the following options. Let the baby suck on his hands. If he is at least 5 weeks old and breastfeeding is going well, parents may try a pacifier. Not all babies are calmed by sucking, but some babies really benefit from the sucking action. Show the baby their face. Familiar faces can be comforting. Speak or sing softly, using the same words over and over. This is repetition to soothe. Holding, rocking, or stroking the baby over and over. This is another form of repetition to soothe. Babies will take longer to calm down if they are very young or very upset. So encourage parents to be patient and keep repeating 1 or 2 soothing actions long enough for them to be effective before trying something else. Parents will notice that when the baby starts to calm down, the sound of the crying will change. By listening for a change in the baby's cry, parents will know they are helping the baby calm down even before he stops crying completely. Persistent crying refers to daily, inconsolable crying. crying that continues in spite of soothing, changes in environment, or other interventions. Persistent crying is not typical, but applies to about 20% of babies in the first 3 months. Excessive crying in babies due to digestive issues has been called colic, but colic doesn't have a consistent definition. Only 25 to 30% of persistent criers have digestive problems, so colic isn't an accurate label for the 70 to 75% of babies who cry inconsolably, even though they don't have any signs of malabsorption. Mothers may be convinced that persistent crying is related to feeding, and they might give up breastfeeding or ask to switch to a different formula to address the problem, even though the baby is growing well. It is very stressful for the parents to have a baby that never seems to stop crying. Persistent crying may be associated with maternal depression and sometimes child abuse. The good news is that 95% of persistent criers are healthy and thriving, and that persistent crying typically improves by the time the baby is 12 to 16 weeks old. The bad news is that it can take 12 to 16 weeks before the persistent crier settles down. That can be a very long time for stressed parents who may need additional support. There are a number of possible reasons for persistent crying. Babies' bodies are sometimes immature, which makes them overreact to stimulation. Some babies are unable to soothe themselves. Others may be unable to regulate their own states. You might see babies with this issue swinging wildly from being calm and alert 1 minute to screaming the next for no apparent reason. Some infants have trouble giving readable cues. When their cues aren't readable, their caregivers aren't able to respond to those cues early. Therefore, after these babies try to use cues without success, they become so upset that they start to cry. Crying is their only successful way to communicate that they need help. Infant illness, injury, or GI problems may also cause persistent crying. Persistent crying should be investigated by the doctor to rule out any medical conditions. All babies who are inconsolable after 3 months should be referred to a medical provider. Some parents may need a referral for professional help. Doctors and other professionals can help these babies and parents. Once medical conditions have been ruled out, you can provide some tips for parents who are dealing with persistent crying. First, parents should be encouraged to get help from trusted family and friends. Taking care of a baby who cries all the time is stressful and exhausting. Second, help parents understand that they can address cues early to reduce but not eliminate crying, and that the cues may be hard to read at first, but will improve with practice. Unfortunately, persistent criers get upset very easily, and it is important for their parents to know that their baby's crying is not their fault. They should look for small improvements in their baby's cues and responses. Because persistent criers are easily overstimulated, these babies may cry less when their environment has less stimulation, like in a quiet room. However, many of these babies do just as well when they are exposed to repetitive stimulation, like a bouncy chair or swing. The bouncy chair or swing should not have music or other stimulation turned on. Although this may seem boring to adults, the repetition is calming to these easily overstimulated babies. Persistent criers sometimes overreact to changes in their environment. Keeping on a loose schedule may help if parents can keep the stimulation similar throughout the day. Soothing techniques can be helpful as well, but beware of overuse. Some parents may be so worried about keeping their baby from crying that they don't interact when the baby is alert and giving engagement cues. Babies need to interact for healthy development. As noted previously, parents may need medical or other professional help to help them cope with persistent crying. In this module, you learned about 2 ways babies communicate, through cues and through crying. You learned how to recognize and respond to 4 different types of cues: engagement, disengagement, hunger, and fullness. You learned that crying is an important communication skill for babies. We reviewed how to determine if a baby is crying due to hunger by looking for the baby's cues, and we went over tips for soothing babies who continue to cry after feeding. You also learned about reasons for persistent crying and some tips to help parents with babies who continue to cry despite efforts to soothe them.